welcome in to Getting Help from Uncle Sam, and we are delighted today to have with us Lindy Blanchard. Lindy is running for governor, and we are trying to touch on topics that are of interest to you and actually listen to some solutions from our candidates. And Lindy, we've talked about so many different things.
Yes, we have.
And there's something that I'm a mother first and foremost. That's what I am. And you know better than anybody else. You've adopted children.
Adopted five.
At 5.
Mom of 8.
And my goodness, and you and your husband have started orphanages. So what I want to talk about today is health care for our children.
Well, I can tell you, when I first adopted one of my children, she was a heart baby, and living in Montgomery, I thought I would just go to the doctor and they would check her, but I had to drive to Birmingham, Alabama to find a pediatric heart specialist. And not everyone can afford to do that, and it's frightening having 8 children that on some things you just have to get up and leave and go to Birmingham for your children because it's not provided in this area. So as governor of this state, certainly I'll focus on rural health, getting more exact help, and by that I mean pediatric, and look up the needs on what we don't have in this area, because we need to provide health for this area other than Birmingham. Otherwise, we're going to be a dying area, and we want the whole state to rise up together and stay at the top, and certainly we want to keep good health care, and without that, you're not going to bring people into this state.
Well, I think, you were appalled at the fact that the capital of our state, which, is the governor's home.
Governor's home.
We don't have pediatric health care. If Tupelo, Mississippi, and Columbus, Georgia have better pediatric care than the capital of the state of Alabama, I am thankful that you are focusing on some of this.
Well, when I've been traveling the state, number one issue along with education and immigration issues are, the focus of families on health care, whether it's a specialty for pediatrics or other specialists. They're concerned. You can have a small injury, but it can end up infected, or so
Right.
You need a specialist in that area that can focus on wound care. And in our capital, we are neglecting our healthcare system because we don't have doctors that want to move into this area. And in my Bible class, we have a small group, and one of the leaders in the class, it's in her home, is someone that's trying to get doctors to Montgomery, to come and live in Montgomery, Alabama. And she is having a time, and it's because of safety. We have issues with things that are going on in Montgomery. I hate to talk about it because I love Montgomery. I've lived here my whole life, but we have issues with crime, and we have issues with education. And those two things you have to provide to anyone that's willing to come to a state, much less an area. And so I'll be that governor that focuses on equal opportunity for hospitals to come in and bid on putting a service in an area. You can't say, okay, we're health providers, but we're only allowing a certain group of health providers that are already in this state to provide for the rest of the state. To me, that's not a healthy system. It's not the business way. The business way is to offer everything in business, open bidding. Otherwise, you don't get the best.
Well, you're absolutely right about the reasons that it's hard to recruit. The other thing I loved that we had talked about was the fact that you're willing to look at innovative ways like telemedicine.
But for telemedicine, you have to have good broadband width as well.
Right.
And Mississippi has passed Alabama in broadband width. They have 1 gigabyte, 80% coverage in Mississippi. And Alabama has 1 gigabyte, 60% coverage. So if you're talking about internet connectivity in rural areas and the telehealth care system, we've got to do better so that we can provide that in rural areas.
I could not agree with you more. I think one of the key things, we were also talking about the fact that eventually the military community, that is a major source of concern for me, because we're all here and free because of those people that are willing to lay down their lives.
Yes.
And eventually the health care will be within the communities for the military, except for active duty. So those are things that I agree with you. We need to be looking at, and I like the fact that you're looking forward.
And just the fact that Maxwell will not be able to provide for the families of active duty will put an extra burden on the healthcare system for Montgomery, as well as the surrounding areas. We need to provide services for our service people, and they're out there risking their lives, and we need to be able to protect their family lives, and in a good way, in a wonderful healthcare system in this area. So it'll certainly be a focus. And like I said, as a businesswoman, I'll open the door to business opportunities for all healthcare systems.
Now, you touched on immigration in a previous segment, and it's amazing, as you have said, it all weaves in together.
It does.
Education, crime, safety, immigration, and that also affects our health care system.
The illegals that are in states and are provided health care, free health care. So they use it and overuse it more than the average person. They'll walk into a hospital and expect treatment for the common cold, or a small rash that most of us wouldn't even go to an emergency room for, and because we have to pay deductibles, and we think, okay, can I afford that? I'll try and work through it for a while. So illegals have more access to health care than the normal Alabama citizen, because we're paying co-pays to get to see a physician, and illegals are not doing that. So they take advantage of our system, and that's why as governor I'll focus on keeping the illegals out, and when they come in, getting them out.
And like we said before, and like you have said, you're all for immigration if it's done the legal way. We're all...
If it's legal,
right.
It's done well. That's why we have the system. It's called the legal way, and I love my children, and I wouldn't give anything for them, but I did it legally, and they're American citizens.
Well, when we talk about legal, it encompasses many things, and folks, the system for voting in Alabama is really good. It's been done well. We ask you, study your candidates, and please get out and vote. And thank you so much for being with us, Lindy.
Thank you.
And we'll be right back.